Imagine if you couldn't leave the house without locking the door, or imagine if you had to turn the light switch on and off for a number of times before you can relax. Your life would be filled with all these little eccentricities. If you have never met an obsessive-compulsive before, then you can think these little things that they do are weird and it might stop you from making friends with them, but this is something that they have to do. They don't do these things because they are weird, they do them because they believe that something awful will happen if they don't do them. It is a matter of life or death for them, and for some people it will ruin their life. You are probably thinking of a number of different people who have weird habits. You might have an aunt who washes her hands after touching anything, or you might have a cousin who doesn't walk on the cracks in the pavement, but they might have mild cases. Ask yourself, does your aunt freak out if she doesn't wash her hands, or does your cousin think he or she is going to die if they step on the cracks? Whilst you have thought about, you have probably noticed hundreds of times that they have not done the things that they need to do and been fine. It is likely the case that for them, their habits are something that they like to keep up, but if they don't, then their world won't end. You see, for an obsessive-compulsive, their world will end if they don't do these things, or so they believe anyway. They are terrified, and this is the only way that they can manage that fear. Treatment. There are a few treatments available for people if they suffer from OCD, however, the treatment is all dependent on how much the disorder is disrupting the way that they function. There are two main treatments that people can get. Medication cognitive behavioral therapy. If you are suffering from OCD, then you can get access to both of these treatments on the NHS, but it all depends on the severity of the disorder. If your condition is severe, then you may need both treatments at the same time to try and conquer your fears. Therapy. For mild cases of the disorder, treatment is with cognitive behavioral therapy. This is a form of talking therapy where the therapist will talk you through things that might be bothering you. Once you are at the root of the problem, the therapist will teach you new ways to think about things, and he or she will teach you how to cope with fear. They can also treat the anxiety head-on and give you a treatment similar to that of POCD sufferers. This involves overexposure to the thing that is giving you the most anxiety. This is done over a number of sessions, so don't worry about having a 1-hour session and then being bombarded over and over again. The process will be gradual and done in a controlled setting. At no point will you be in any physical danger. It will take a long time, and you might find that you need over 10 hours of treatment. If you do, don't feel downhearted, you aren't going to change overnight, and the length of the treatment is perfectly normal. If you feel embarrassed about how much treatment that you need, then don't tell anyone. It is no one's business but your own.